You're listening to Fast Facts, Ask the Expert with Tom Viola. All right, listeners, welcome back into this Fast Facts, Ask the Expert. We have Tom Viola. We're talking about local anesthesia. Tom, thank you so much for being here today.
Andrew, it's always a pleasure working with you, buddy. Thank you for what you do for the profession of hygiene, buddy. You're a pillar in this community.
Stop it. But good look. Okay, we're going to see how much of a pillar I am because I don't actually know the answer to some of these ones. So here we go. So when I was going through school, you go through local anesthesia course, and ours was very robust. I loved it. But you learn about some drugs that maybe you don't necessarily use in practice. I started on pediatrics, so of course the question I have coming up was never used in pediatrics. And so my question is, like, when should bupivacaine be used in dentistry? And kind of a follow-up question to that is, like, are you hearing that it's used quite often or not really all that much?
I'm seeing bupivacaine used more and more in the practice of dentistry and dental hygiene than I have in the past. And I think that's because people are starting to see that bupivacaine is a viable option to manage pain, post-operative dental pain, other than maybe necessarily using opioids for the same purpose. Bupivacaine is the longest acting anesthetic agent we have. It's hours compared to the others, which are minutes. And as such, bupivacaine lends itself to very long procedures, full mouth extractions, sinus lifts, and all-on-4 surgery, that kind of thing, where you're going to be at it for hours. And so as a hygienist, you may not see a real use for bupivacaine in your practice, but realize that bupivacaine offers options that we may not necessarily recognize initially. So yes, it's very long acting. And yes, you can use bupivacaine not just during procedures, but also after procedures to keep the patient anesthetized for hours and therefore maybe help alleviate some of that pain, that initial pain they get after a procedure, as well as hours later when some of the naturally occurring opioids, which we call endorphins, start to wear off and the pain starts to magnify. So all good stuff using Marcaine after procedures to ameliorate pain. But from a hygienist perspective, I think we're missing some of the benefits of bupivacaine in that, number one, the reason why bupivacaine is so long-acting is because it latches on to the neuronal membrane and doesn't want to let go. So as a result, it can be used in situations where patients are somewhat difficult to anesthetize. Now, this always comes up because, who are these patients that are so difficult to anesthetize? And one of the first patients we think about are patients with red hair. Why are patients with red hair so difficult to anesthetize? I think the answer is we just don't know. I think the prevailing theory I've heard is that patients with red hair may have neurons that depolarize more quickly than the neurons of people who don't have red hair. And so local anesthesia really doesn't work very well on them, and it's more difficult to get them anesthetized because they feel pain faster and more profoundly, let's say, than someone who doesn't have red hair. So that's the prevailing theory, and I've seen bupivacaine work pretty well in that situation. Another situation I've seen bupivacaine work very well in is in patients who have a previous history of substance abuse, especially if you consider methamphetamine and cocaine. And the reason for that, obviously, is because these drugs, so both methamphetamine and cocaine, are structurally similar to anesthetic agents. As a matter of fact, cocaine was an anesthetic agent that was used in dentistry some many years ago when dentistry was cool. No, just kidding. So, imagine a patient who has used cocaine in the past or methamphetamine in the past and has developed a resistance to these two drugs. Well, obviously, because of the structural similarity, they might be more resistant to the effects of anesthetic agents as well. And finally, we have the patient who's a regular and perhaps frequent cannabis user. Again, no studies have pointed this out with any real veracity, but just anecdotally, it appears that patients who are frequent, heavy cannabis users are more likely to be more difficult to anesthetize than a patient who doesn't use cannabis. Again, as a hygienist, you're hearing me say this and you're saying, that sounds great, Tom, but guess what? I don't want my patient numb for 8 hours after their hygiene procedure. That doesn't make any sense. And to that I say, well done, but remember, no one said we had to use the full cartridge. So,
good point.
Right? So you can use 1/8 of a cartridge or 1/4 of a cartridge, maybe in combination with an articaine or a bupivacaine to get the patient over the perceived hump, if you will, right? That difficulty in getting them initially anesthetized and leading up to profound anesthesia later on.
Tom, thank you so much. This is awesome. If someone wanted to reach out to you, how can they find you?
You can find me anywhere on social media at Pharmacology Declassified and on my website at tomviola.com.
Great.
Thank you for listening to Fast Facts Ask the Expert. If you have a topic you'd like one of our experts to answer, simply email me, Andrew@ataleoftwohygienist.com, and we will get it on the air as soon as possible. Thanks for listening.